I'm Dr. Jonathan Craighead, and this is a short video to make sure that you are prepared for your upcoming shoulder replacement surgery. Your surgery will be in the morning, and the JCMG Surgery Center will be contacting you on the evening before your surgery with the specific arrival time and further information. Typically, you will be asked to arrive at the surgery center approximately 90 to 120 minutes prior to your scheduled surgery time. The surgery will last approximately 1 to 2 hours, and you will be in the recovery room approximately 1 to 2 hours afterwards. You will need a ride home from your surgery and someone to stay with you for a few days afterwards. Please bring your sling with you on the day of surgery. We have sent your post-operative prescriptions into the pharmacy of your choice. Please make sure to pick them up prior to your surgery and have them available at home. You do not need to bring them with you to the surgery center. If you were on a blood thinner, you will need to stop this prior to surgery. Coumadin and Plavix should be stopped at least 5 days prior to your surgery. Xarelto and Eliquis should be stopped at least 3 days prior to your surgery. Make sure that your house is ready for you when you come home after your surgery. Please remove any loose rugs, cords, or clutter that may be a tripping hazard. You should not eat anything 8 hours prior to your surgery. You may drink some clear liquids up until 2 hours prior to your scheduled arrival at the surgery center. Approved liquids to drink include water, tea, black coffee, apple juice, cranberry juice, Gatorade, Powerade, and grape juice. If you do drink tea or coffee, it should be black and there should be no cream products in it. You should not drink any milk or milk products, orange juice, grapefruit juice, tomato juice, alcoholic beverages, or carbonated beverages within 8 hours of your surgery. Ensure makes a pre-surgery clear carbohydrate drink that we recommend drinking 2 hours prior to your arrival. This can be purchased at most pharmacies. If you cannot find the Ensure pre-surgery drink, Gatorade or Powerade works well also. The morning of surgery, you may take your normal medications with a sip of water. However, please do not take any blood pressure medication the morning of surgery, especially ACE inhibitors like lisinopril, captopril, or enalapril. The night before surgery and the morning of your surgery, we would ask that you shower and scrub your shoulder with an antibacterial soap. If you have any cuts, open sores, or feel like you may have a potential infection, please contact our office immediately. Once again, it's important to us that you feel safe and comfortable throughout this process. If there are any additional questions that we can answer for you, please do not hesitate to contact us.